In this video, we are going to discuss about wound healing. What is wound healing? Wound healing is a complex method to achieve the anatomical and functional integrity of a disturbed tissue or the disrupted tissue by the various components. So guys, what they are saying, if there is a normal tissue and this tissue is disturbed, so the anatomy as well as the function, the structure as well as the function is disrupted. Now you are achieving back the integrity of the disrupted tissue with the help of the components like neutrophils, macrophages, lymphocytes, fibroblasts and collagen. All these things is happening in an organized stage pathway, which will be dealing in the upcoming slides. The staged pathways. The stage pathways are, first comes hemostasis, then there is inflammation, inflammatory stage, and then we have a proliferative stage where proliferation occurs, and then the matrix synthesis where there is collagen and proteoglycan ground substance playing a role. Then occurs maturation, and the fourth stage is remodeling. Hemostasis and inflammation, first stage, second stage proliferative stage, third maturation, fourth remodeling. We have epithelialization. The wound, if this is the wound, it is going to contract with the help of the myofibroblast so that the rapid healing can take place. We'll be dealing in detail of these steps in the upcoming slides. Now the types of the wound healing: primary healing or first intention, or secondary healing or healing by secondary intention. Healing by third intention is tertiary wound healing, or also known as delayed primary closure. So primary healing occurs in a clean incised wound or a surgical wound. Now you can see here it is occurring in a clean incised. This wound is clearly incised wound. Okay, clean incised wound or a surgical wound. The wound edges are approximated with the suture. Now you can see in the picture here, these wound edges which were here are approximated with the help of these sutures. There is more epithelial regeneration than the fibrosis. So they are talking about the epithelial regeneration. Epithelial, it is nothing but the recruitment of the stem cells to replace the damaged cells. So the regeneration is happening. These damaged cells are being replaced by the new epithelial stem cells. Than the fibrosis. So what is fibrosis? Then thickening and scarring is nothing but fibrosis. In primary healing, we see the rapid epithelialization. Compared to the scarring, there is more healing and rapid epithelialization is taking place. Wounds will heal rapidly with a complete closure. The scar in the primary healing is going to be linear, smooth and supple. So what do they mean by supple here? So supple skin means a perfect skin which is soft to touch and radiant to look. So by the primary healing, there will be clean incised wounds or the surgical wounds, early suturing, and the scar is going to be very minimum, hairline scar. Now you can see the primary intention healing. Okay. Then the secondary intention healing, it occurs in the wound with the extensive soft tissue loss. So the soft tissues are being lost to a greater extent here. It is occurring in major traumas, burns, wound with the sepsis. You can see in the burn, soft tissue loss is there, and also it is occurring in sepsis. It will heal slowly with fibrosis. So guys, I told you fibrosis is nothing but the thickening and scarring. In secondary intention, we get to see more scarring. It will lead to a wide scar. Often the scar is going to be hypertrophied and contracted. Now you can see the hypertrophied and contracted scar here. This scar will be found in secondary intention healing. Okay. And then it is leading to the disability. Re-epithelialization occurs from the remaining dermal elements or wound margins. So they are talking about re-epithelialization. So you see here, this is the site of the wound. So there is a damage here, but the remaining, the adjacent cells, the dermal elements or the wound margins are going to re-epithelialize, and they are going to close this wound coming in this way. Okay, and then they'll close the wound. and it is occurring from the wound margins. Now you saw the hypertrophied scar, then the secondary intention, irregular wounds will be there, epithelial cells and the scar tissues will be more fibrosis is going to happen, and the scar is going to be hypertrophied. The secondary intention healing, you can see the scar here. And then we move on to the healing by third intention, that is tertiary wound healing or the delayed primary closure. Wound is intentionally left open after the debridement of the non-viable tissues. So the debridement is a procedure which is for used to treat the wound in the skin. It will it is nothing but the thoroughly cleaning of the wound and removing the hyperkeratotic thickened cells, thickened skin, the callus, the infection and the non-viable necrotic tissues, foreign debris, all these debris and the material, all those things are going to be removed, and then intentionally you are going to leave the wound open. Subsequently, after a period of time, the surgical repair of the wound which is initially left open is done. Okay, this is resulting in the complicated scars. So you can see there is a delayed primary closure. Your only the debridement is done, that is you are removing the things, but then you are not closing it, only removal is done. Then after a period of time the suture is done, resulting in the scar. Primary contaminated or mixed tissue wounds will heal by the tertiary intention. So which injuries come under tertiary intention? The contaminated or mixed tissue wound. You can see the mixed tissue wound here. These fall under the healing by tertiary intention. This is a scar of a healing by tertiary intention. So we are going to move on to the stages of wound healing now. There is stage of inflammation, then comes the stage of granulation tissue formation. Here it is due to the fibroblastic activity, the synthesization of collagen and ground substance. Then we have stage of epithelialization, scar formation and resorption and maturation. In detail, inflammatory phase, Lagor substrator exudative phase. It is beginning immediately after the formation and it is lasting for about 72 hours. There is initial arteriolar vasoconstriction, thrombus formation, platelet aggregation due to the endothelial damage. So guys, you can see here, this is the the part which is going to be injured, and then what's happening, this is the injury. Because of the injury, this blood vessel, what happens, first there is vasoconstriction of the blood vessel to reduce the blood loss. Okay, to reduce the hemorrhage or the bleeding, the vasoconstriction takes place, the arteriolar vasoconstriction. Then there is a clot formation. How does this clot form? With the help of the platelets which are going here, they are going to adhere. The platelet aggregation occurs. It is because of the endothelium being damaged, and there is a release of adenosine diphosphate, which is nothing but ADP. Now you can see in the next picture here, this is the site of the injury, the reflex vasoconstriction happening. Once there is vasoconstriction, these platelets, aggregation of the platelets resulting in the hemostatic plug, and there is release of ADP, platelet adhesions happening. There is platelet aggregation and adhesion to the injured site, and also there is a release of ADP. So this is the inflammatory stage. Next follows the persistent progressive vasodilation. So first what happened, there is vasoconstriction, thrombus formation and then platelet aggregation. Then there is also release of ATP. Now comes the vasodilation, progressive vasodilation. It is involving mainly the arterioles, but to a lesser extent you even see the microcirculations like the venules and capillaries also being vasodilated. This change is obvious within half hour of an injury. So why is the vasodilation happening? So this is the remaining healthy blood vessel and this is the injured one. Injured one, there is like a sealing which is formed by the hemostasis happened and there is a plug formation. Now the remaining blood vessel is vasodilated. It is vasodilated to increase the blood flow. It is resulting in the increased blood volume in microvascular blood area. It is responsible for the redness and the warmth at the site of the inflammation. This increased vasodilation, increased blood flow to the injured site for the rapid healing. All those why does the blood flow increase? It is because the blood vessels, the blood flow is going to contain the WBCs, which are useful for killing the bacteria. Then once the vasodilation occurs and the blood flow is increased, there will be warmth at the site of inflammation. Progressive vasodilation in turn will elevate the local hydrostatic pressure. Because of the increased vasodilation, the hydrostatic pressure is going to increase, resulting in the transudation of fluid into extracellular space. So this is the blood vessel. Then the blood flow is increasing, so the hydrostatic pressure increases. Because of this, the blood there is transudation of the fluid. This fluid will transudate into the extracellular space, that is nothing but the interstitial tissues. This is responsible for the swelling. So we saw the redness is because of the vasodilation. Second thing, there is increased hydrostatic pressure, which is resulting in the escape of the fluid into the interstitial tissues or the extracellular space, resulting in the swelling of that area. Localized swelling occurs because of that. Slowing or stasis of the microcirculation follows, which causes increased concentration of red cells and thus the raised blood viscosity. Now you saw that the blood flow is increased, and that blood flow is going to pass very slowly. There is reduced flow, slowly it's going to pass at the site of injury. It is to increase the concentration of red cells so that the red cells concentration is increased and the blood's viscosity is increased because of this. Now you can see in the picture here, the red cells viscosity is increased, the blood's viscosity is increased because of the increased red cells. Stasis or slowing. Stasis, we saw now, stasis is nothing but the slowing. It is followed, first there was red cells, now it is followed by the leukocytic margination or the peripheral orientation of the leukocytes. So what's happening? Followed by the RBCs, the leukocytes are going to form the orientation in the peripheral site. Mainly in the leukocytes, the neutrophils are going to play a major role here along the vascular endothelium. So guys, you can see here the normal blood vessel how it is, and here there is a vasoconstriction followed by the increased vascular permeability resulting in the increased blood flow. Then we have the clot formation, and then the thrombus is nothing but the clot formation, and then the RBCs are increased, and then there is also leukocytic infiltration. Then we move on to the next stage. This is the inflammatory stage. The RBCs came into the role and leukocytes migration happened. Now what happens? There is proliferative phase. In the proliferative phase comes the collagen and fibroblastic, also the collagen or fibroblastic phase. It is beginning from the third day of injury and it is lasting for 3 to 6 weeks. There will be the formation of granulation tissue. So healing begins here. That was inflammation. A response, okay. Now a response to the injury, inflammation took place. Now the actual healing, granulation tissue formation, and there is repair of the wound. Granulation tissue is containing the fibroblast. Neocapillaries are nothing but the new blood vessels, collagen, fibronectin and hyaluronic acid. So guys, you can see here the granulation tissue formation and the fibrin clot and the new blood vessels, neovascularization in the proliferative stage. Initial angiogenesis, growth of, what is angiogenesis? That is nothing but the growth of new blood vessels. It occurs because of the release of vascular endothelial cell growth factor by the keratinocytes. So the vascular endothelial growth factor is released by keratinocytes, and by the release of tumor necrosis factor alpha, tumor growth factor beta and platelet derived growth factor along with the fibroblast growth factor is by the macrophages. We have vascular endothelial growth factor by the keratinocytes and the remaining TNF alpha, TGF beta, and then PDGF and FGF is by the macrophages. So these are resulting in the angiogenesis, which is by the, that is nothing but the growth of new blood vessels. So two things are playing a role in the formation of the new blood vessels, that is keratinocytes and macrophages, which are releasing these factors which help in the formation of this new blood vessels to the injured site. Eventually what's happening, there is fibroplasia. Then it is going to be developed by the fibroblast activity with the formation of collagen and ground substance, also the glycosaminoglycans. So this fibroplasia, why does the fibroplasia occur? It is because of this fibroblast activity, and there is formation of collagen and ground substance. The type 3 collagen is deposited in a random fashion initially. Then what happens in the next thing? The re-epithelialization of the wound surface will occur by the retained epidermis, which then proliferates. So guys, I told you the remaining these viable things, okay, these are going to re-epithelialize the wound surface. They are going to re-epithelialize it, and then what happens once there is re-epithelialization, later there is proliferation. They are going to re-epithelialize, and later they are going to proliferate, and then they are going to differentiate based on the type. If it is columnar, then the new cells are going to become columnar. If they are a round shape, they will become round shape. So based on the site where they are injured, they are going to be differentiating, and they are stratified to form the wound closure. Then comes the last phase, remodeling phase, also known as the maturation phase. It is beginning at the 6th week, and it is lasting for 6 months to 1 to 2 years. There is maturation of collagen by the cross-linking and realignment of the collagen fibers. So we saw in the first thing, they are arranged in a random fashion, but during the maturation what happens, the cross linking happens. You can see the cross linking of the fibers here, and also there is realignment of the collagen fibers along the line of tension. It is responsible for the tensile strength of the scar. We saw the hypertrophied scar, how strong the scar was. It is who is playing a role in the tensile strength of the scar? This collagen fibers, which are arranged in a cross-linked pattern along the line of tension, is responsible for the tensile strength of the scar. And the scar formation is occurring beginning from the 6th week, and it is lasting for 6 months to 1 to 2 years. Now this is strengthening of the scar, freshly healed epidermis, you can see. Now there is a reduced wound vascularity, fibroblast and the myofibroblast activity. So you can see the fibroblastic and myofibroblastic activity resulting in the wound contraction. Later on what happens? Once the wound is, so this large the wound was, okay. So what happens after a few months, the wound is going to 6 weeks to few months, the wound is going to contract, become small, so that the healing can occur rapidly. Now we move on to the factors which are affecting the wound healing. Age. In the younger age group, the wound healing is faster and better. Whereas in elderly healing, it is going to be delayed because of the reduction in the collagen synthesis, reduction in the epithelialization, and the growth factors is also reduced in number. We saw the various growth factors: vascular endothelial growth factor, tumor necrosis factor alpha, and then fibroblast growth factor, and all those. And there is also reduced angiogenesis, which is nothing but the formation of new blood vessels. Nutrition. Adequate vitamin, trace elements, fatty acids, and proteins are very essential for the wound healing. Vitamin A deficiency will affect the monocyte activation. So guys, you can see here the leukocytes, all types of leukocytes are very important. They are very important in the wound healing. So whenever there is vitamin A deficiency, it is going to affect the monocyte activation, also the inflammatory phase, collagen synthesis, and the growth factor actions. Whereas the vitamin K deficiency is affecting the synthesis of prothrombin, which is responsible for clotting. Vitamin C deficiency will impair the collagen synthesis, fibroblast proliferation, and angiogenesis. It increases the capillary fragility and the susceptibility for infection. So, vitamin C deficiency is a cause for the increased infections in people, and also the capillaries fragility is increased, so they are going to become very fragile. Zinc is an essential cofactor for the RNA as well as DNA polymerase. Magnesium is used for the synthesis of proteins and collagen. So, any deficiency of these can hamper the wound healing. Collagen is a major protein which is a component of the connective tissue. Now, the unsaturated fatty acids which cannot be synthesized by the mammals. So, these polyunsaturated fatty acids, we ourselves cannot synthesize them. And these polyunsaturated fatty acids will consist mainly the omega 6 and omega 3. This omega 6 is found in soybean oil and omega 3 is found in fish oil. Such as, and then they will contain the fatty acids, right? Those fatty acids names are eicosapentaenoic acid EPA and docosahexaenoic acid DHA. So guys, you see, we cannot synthesize them on our own. They cannot be synthesized by mammal. They are found in soybean oil and fish oil, and they contain the fatty acids named as EPA and DHA. They are required for the wound healing. They affect the pro-inflammatory cytokine production, cell metabolism, gene expression, and angiogenesis. They improve the systemic immune function of the host, thus they are reducing the infectious complications. Now let us see the local factors and the general factors which are affecting the wound healing. Local factors such as infection at the site of injury or the presence of the necrotic tissue, that is the dead tissue and the foreign body being present in the injured site, or the poor blood supply, venous or lymph stasis, tissue tension, hematoma, large defect or the poor opposition. If there is a very large injury, large defect involving the mixed tissues, recurrent trauma to the site of injury, X-ray irradiated area. The site of the wound, example, the wound over the joints and the back has the poor healing. So wounds which happen over the joint as also on the back, so there is increased activity of these parts. They cannot be stationary. As a result, the healing is going to be delayed in them. Underlying diseases like the osteomyelitis, there is infections of the bone by the microorganisms, and the malignancies, cancerous conditions can also cause a delayed wound healing. Mechanism and the type of the wound: incised, lacerated, crush, avulsion. Tissue hypoxia will locally reduce the macrophage and fibroblastic activity. The general factors: the age. Now we saw in the younger it is fast, whereas in elderly it is quite delayed. Obesity, smoking, alcohol, stress, the malnutrition, zinc, copper, manganese, and the vitamin deficiencies like vitamin C and vitamin A. We saw in particular what these deficiencies will alter. Anemia and hypoxia, malignancy, uremia, jaundice, diabetes and metabolic diseases, HIV and the immunosuppressive diseases, the steroids and cytotoxic drugs, neuropathies of the different causes can also be a factor for the wound healing, which is affecting the wound healing. So with this we come to an end of the factors affecting wound healing and the stages of wound healing.